Hi, my name is Jess, and I wanted to talk about my role as a primary therapist. So I'm currently working in a partial hospitalization program with eating disorder patients, primarily with athletes. In my role as a primary therapist, I have individual therapy, group therapy. So group therapy I run 3 times a week. It's a process group. I also do a group on ACT, which is acceptance and commitment therapy. I also have the opportunity to eat meals with my patients. I'm able to, particularly with the athletes, do workouts. So I'll take them on walks, I'll take them in the gym, kind of work on just exactly what they're struggling with, which is a lot of fun for me since I have a background in sports psychology. Another role as a primary therapist, so I do a lot of supervision. So I am involved in peer supervisions, group supervisions, individual supervisions with the clinical director. I also get the opportunity to supervise master's students, and so I really like teaching and learning through the supervisions. We also have the opportunity to do staffings, and staffings at our facility are a little bit unique. So we all work on a treatment team, and I'm the point person for the treatment team. So I'm able to really pull together all the information for the patients who are in the partial hospitalization program, whether it's through psychiatry, family therapy, with their trainers, with the dietitians or the nutritionists, also all the group therapy. Anybody that's running any part of the program will be in the staffings with me. So I get the opportunity to hear everything that goes on. And then I get to be really the point person. I relay information to the patients about how they're doing, how they're working on their eating disorder, and how they're kind of coming along with everything else that goes along with that. I also often have the opportunity to do outpatient therapy, so it's kind of nice because I get to follow patients throughout their treatment, particularly if they're remaining local. Usually I work 9 to 5. I don't do anything on call. I just, pretty typical schedule. I get to make my schedule every Friday for the following week, and it can be pretty flexible. I've gotten the opportunity to teach, to do some other things, so I really enjoy it. I'm also doing a lot of research with athletes. It's really new to be able to have athletes get eating disorder treatment. They typically don't come into our treatment programs because they're so concerned about losing performance. So I've gotten the opportunity to really do some innovative research, and I'm getting to learn a lot. For the most part, I feel like the stress level varies. We have some pretty stressful patients when they get to the partial hospitalization level. That means they're in our program for 10 hours a day and they're actually quite ill. Typically, everyone that comes in the door has an eating disorder, but you'll mostly see some substance abuse, depression, anxiety, lots of trauma, and so you kind of get a variety. So it depends on the patients that are in the program at the time. I usually have between 6 and 8 patients at a time, so again, it just really depends on what patients I have in the program at the time, because they're usually there for just a couple of months. So that's really varies as far as the stress level. All right, so the requirements for being a primary therapist at an eating disorder treatment facility, you need a background in counseling psych, clinical psych, social work, any psychology, and we don't have to be licensed. The cool thing about the place where I work is they provide a lot of supervision, so we actually have a lot of people working on their licenses. The benefit of being licensed for me is that we can bill insurance, so there needs to be enough of us that are licensed in the facility, but specifically I don't really have to be licensed. Some education that really helped me along the way was my doctorate in psychology. I really felt like that set me up to get exactly where I am. Prior to my doctorate in clinical psych, I got a master's in sport and performance psychology. And again, the two of those really combined allowed me to work with eating disorders and sport and performance psychology because it's such a unique culture and population. When you're looking and working with athletes, it is really important to be able to understand the sports psychology aspects. So I felt like that was really, really helpful when I went in and designed this program for working with athletes in eating disorders. I feel like one of the most important parts of my journey was really getting internships and exactly what I wanted to do. So I was fortunate enough to get a lot of good clinical experience in eating disorders as well as working with athletes. And so I worked in college athletic departments, I worked in counseling centers, and I worked in eating disorder treatment facilities along the way throughout my graduate training. And so I really felt like that was something that gave me the experience that I needed to be able to work with this population and to create the program that I have. As far as licensure, I felt like it was really beneficial to get the state licensure as well as the national licensure, and I've been able to maintain those. I also got my certification in sport and performance psychology and got on the registry for the U.S. Olympic Committee. So again, I'm a referral source for the Olympic Committee for eating disorders in the case that they need that. So I've been working pretty closely with them as well. So those certifications have really been pretty important. I have a certification it's called ASP, the Association of Applied Sport Psychology. I'm a certified consultant, and so I feel like that was really important to gain some credibility in the field of athletes. And so I felt like that was just exactly what I needed to make sure that I was able to work with that particular population. And with eating disorders, I also felt like I needed the clinical piece. So I was licensed as a psychologist and was able to really figure out kind of the clinical piece and the performance piece and really come together in just one program that I created for these athletes with eating disorders. Something that I didn't really expect. It was a really pretty long journey. I don't think I would have done anything differently. And I did go the route of a PsyD, which was a little bit more expensive, but I do think it really set me up. The PhDs are a little bit more research-oriented, but that really wasn't what I wanted. So I went the route of a PsyD and felt like that was a really good fit for me and that I'm in positions to where I can pay back my loans and feel pretty confident about that. So that is one of the things that would come up with pursuing a PsyD that isn't funded by any sort of research. So the best and the worst parts of my job really are probably the flexibility, the variability of what comes in. We really don't know what our schedule is day to day, week to week. We really never know exactly what's coming in. Eating disorders might be one of the hardest things to work with, and you have athletes that come in that have really ingrained something. Eating disorders work for a reason. It's a really good coping skill, although unhealthy. So that makes it really a tough population to work with, but it's also really rewarding. We have patients come in on Mondays and Tuesdays, so we really never know what our week's going to be like. Sometimes that's really exciting, and other times it can be really taxing to just not know what's going on. I do like the fact that I can set my own schedule. I'm able to have the flexibility to teach. I've been able to do a lot with this research, create this program from the ground up, and so I really do feel like it's something that fits me well, but then it is sometimes really difficult when you have a patient come in and maybe doesn't want to be there or is really unsettled or just really, really ill. It's really hard work. The relapse rate for eating disorders is extremely high. So sometimes the work can be hard as well. But overall, I think that it's a good balance of best and worst. All right, so any last advice for anyone that wants to go into this field? I feel like it's so cool that I was able to really integrate clinical psych and sport and performance psych, and I absolutely love my job. I think it's just perfect for me. Along the way, I feel like the best things that I did were to get internships in exactly what I thought I wanted to do. And I tried a lot of things out, and to be honest, there's a lot of things that really didn't work or didn't fit. And I feel like I kind of fell into the position that was right for me. I went into graduate school thinking that I wanted to work in a college counseling center, and that actually didn't work. I really like the challenge and the things that are different. There'd be some great things about doing that as well, but I tried it and I actually felt like this was a better fit. My second piece of advice is I mentioned those organizations. So I have a certification with the Association for Applied Sport Psychology. All through graduate school, I got really involved in the organization, and I felt like that was a really good move. personally and professionally. I've met so many amazing people, and I feel like getting involved in the organizations of the fields that you want to be involved in is really my best piece of advice. Another organization I got really involved with was the American Psychological Association, and specifically Division 47, which is exercise and sport psychology. So again, it just gave me access to a whole nother set of people that were interested in the very same things as me. And between the two organizations, I got a great set of mentors, a great set of friends and colleagues. And so I think that that was probably the most helpful, was to get the experience that I needed in order to see what I did and didn't want to do. And I also felt like I got involved in the organizations and was able to just get really ingrained in the fields and in the community that's in that field.